Som, acho que já está. Está um bocado baixo? Ou é... Vai estar? Ok. Sim, está a entrar muita gente. Ok. Sim, ok. Isto é deste lado. Sim. Se calhar fico só um bocadinho à tua frente, para ser mais fácil de ver. Ok? Okay, good afternoon. My name is Vasco Bastos. This is my colleague, Sofia Franco. We are from Lusofno University. We are going to present to you a little active break, about 2-3 minutes of light physical exercise. So I'm going to ask you to please stand up. Be aware of your surroundings. Please don't hit the person next to you. Make sure you have the necessary space. To start, I'm going to ask you to stretch, put your hands to the front and round your back. Now, open your arms, open your chest. Careful with the person next to you. We're going to do this again. Forward, round your back, tuck your chin, open your arms. Now, this time, put your hands together behind your back. Open your chest a little bit more. Now, your arms to the sides. Breathe in and breathe out. Just one more time. And keep your hands up this time. Stretch up. Now, one arm goes down, the other one goes over. Reach over. Now, switch to the other side. Careful with the person next to you. Okay, now transition to a neck stretch. Just try to relax. The other side. Now the shoulders, keep your shoulder away from your ear. The other one. Now for the final exercise, we're going to do some small squats. So I'm going to ask you to bend your knee. It's a really small one. Bend your knee, take your hands to your knees. Now rise, hands up, and bend your knees, squat down. Up. Just a couple more times. Last one. Okay, thank you very much for this little active break. So just a little information. After the plenary session 2, there's going to be a scenic walking bus. So if you want to promote your physical activity, please join us at the entrance after this session. Thank you very much. At 7.
Okay.
Yeah. So, good late afternoon, ladies and gentlemen, dear colleagues, distinguished guests. Welcome to Plenary 2, Global Health Bridging Research and Policy for Real-World Impact. And what a wonderful start of the plenary with being active. So, my name is Iveta Nagyova, and I'm the president of the European Public Health Association. And I have a really great pleasure and honor to co-chair this session together with Professor Henrique Barros, the president of the ASPHER, Association of Schools of Public Health in the European region. In this plenary, we will explore pressing global health challenges and the importance of transnational collaboration in addressing these issues. Key to our discussion is reverse innovation, which is my favorite topic, and where solutions from low resource settings are adapted to benefit health systems globally, exemplifying how cross-border approaches can advance health outcomes everywhere. We will also emphasize the importance of including vulnerable populations and diverse perspectives in health policy, underscoring equity as a core pillar of sustainable global health solutions. We have 5 amazing speakers today, but we would like to involve also you into our discussions, and therefore we will have an opportunity to engage and ask questions via Slido, which will be managed by my EUPHA colleague Elena Petelos, the President of the Global Health section. And now, without further ado, I would like to give a floor to Professor Barros, who is not only the president of the ASPHER, but also a full professor of epidemiology at the School of Medicine of the University of Porto, and the president of the Institute of Public Health of the University of Porto, where he coordinates the WHO Collaboration Center on Non-Communicable Diseases.
Thank you, Iveta. Thank you very much for your words, and I'm very happy to have you here in Portugal. And all of you, for us, is great, this opportunity. So 15 years ago, writing towards a common definition of global health, a consortium of schools executive board opened the Lancet viewpoint by stating, global health is fashionable. And I can say it remains so. But it's also true that it's not exactly a new thing, or a new field. It's derived from public health and international health, which evolved from public hygiene and tropical medicine, so present yet. However, it is much more than a simple incremental transition, given a booster of interest and awareness with the recent COVID pandemic. Global health can be sought as an objective, a world of healthy people, by looking at the global distribution of health and disease, their determinants, the impact of globalization, and of course, the changes in the nature of health governance. As Ilona Kickbush surely would say if she was here with us. But it's also a mix of scholarship, of research and practice, with its own competencies and tools far beyond the more traditional public health narrower fields. The EU established 1 year ago a joint action on global health with the objective of strengthening the EU leadership and to shape a new global health order based on European fundamental values. The way we understand global health implies a commitment to promote innovation, as Iveta said, and understanding the vital role of reverse innovation, negotiate global sustainable practice, enhance collaborations, empower citizens, strengthen health systems, and provide universal health coverage, in a word, making reality the human right to health. To accomplish it, professionals need a well-defined, multi- and cross-disciplinary approach with an emphasis on understanding different cultural settings, perspectives, and solutions. It means a renewed attention to novel competencies and a sound, flexible, co-created curriculum aiming at all levels of training and careers. That is the challenge that ASPHER wants to embrace, and it is already reflected in the core curriculum program that we are going for public health that is going to be released during this conference next Friday, and I take this opportunity to invite you all to look at it. So without further ado, I'd like to call Charlotte Marchandise. She's the Executive Director of EUPHA. She's also an international expert, a trainer, and a policy advisor specializing in health, climate, and democracy, fundamental aspects of global health, so that she can set the scene.
Yeah.
Charlotte.
Henrique, before giving the space to Charlotte, apologies, we need 2 minutes for our colleague, Elena Petelos, for the engagement on Slido, which we promised to you. So, Elena, please.
So very quickly, we're hoping that all of you can interact with Slido. Some limitations in numbers. At the moment, I think we have the active poll for the word cloud, and there's only 55 reactions. We want you to populate this with any and every question you have. And then during this particular plenary, we're going to have a couple of questions for you to fill in. we want you to be as creative as possible. They're open-ended questions. I think also if we can go back, the Slido code is there. If you have any issues, please reach out to the back. Thank you. Yep.
Amazing. Thank you very much. And now, Charlotte, please, your presentation setting the scene.
Yes, thank you very much. I just lost. Okay. Here's
Oh,
the pointer.
okay.
No, it's all good. Hi, how are you? Less people than this morning. Some people have gone to visit Lisbon. A little with my EUPHA director hat. A little housekeeping. Being kind to each other means also to the staff. We had some people being a little bit hard on our very excellent team. So please protect them and support them. It's been a huge work to organize that. Yeah. So going back to my other hats, because I'm new director of EUPHA, but I've been working locally, nationally as policymaker. I've been working globally in many countries as a public health expert, and I will use both of my hats to set the scene, mostly on global health strategy. And I will set it with the very, very brand new strategy of EUPHA that has been approved yesterday by our governing board. Evidence, equity, engagement, and empowerment. As you see, it matches some of the things that we're already putting there. Happy to see we fit. Now, maybe I will not be the most funny person in the room. We talk about global health, and global health is not always the things that makes you sleep well, at the opposite. The global health section has been framing interconnected themes in its work: pandemics, commercial determinants, human rights, conflicts, planetary health, and all related trends. We have science, but do I need to convince anyone in this room about the health impact of climate change? Do I need to convince anyone here that we need to change the way we travel, we live, we consume? Yet, how many of us can by plane? How many of us are not always eating vegetarian, local, sustainable? I even know that some people here drink alcohol. Yeah, evidence is not enough. And Agnès Buzyn will tell us about that. Sometimes you can have the most cutting-edge science, you can be very reputed science doctor, and yet, even in power position, it's not enough to convince policymakers. I do have sleepless nights thinking about AMR and how my kid could die because of preventable minor injuries. I often have sleepless nights thinking about the right of the people and the right of women in the planet. Our colleagues in Spain, it's sleepless nights and day in the US with Trump election. Our colleagues in Ukraine, and we just welcomed the Ukraine Public Health Association within EUPHA. Our colleagues, yes, you can. Our colleagues in the Middle East are sleepless night and day. People are dying. People are dying in Gaza. People are dying in Israel. And we just, 1 second, and then you can clap. We just released a statement to protect the public health workforce and the women and the children in Gaza. And if you want to endorse this, please come to us. No, it's good. So now how do we do? Global health is also hope. Global health is my personal therapy to feel better, not to feel helpless. And quoting Martin McKee here, that we need a kinder, more inclusive, and socially just world. Apart from Trump, who doesn't want that? Public health is my remedy because public health is fascinating. Public health, I mean, how many of you do you follow, except Elena, the pandemic treaty every day? It could be a Netflix TV show. It has passion, it has drama. We should talk about it. We should do webinars. We should do a Netflix TV show about it. We should communicate inside our bubble, but outside of our bubble too. And to do that, we cannot do it so easily, just with evidence, because sorry to say, evidence in general takes up to 17 years to change practice. Can we afford this gap? No, we cannot. And Sarah Serda has been setting the stage this morning. So what can we do? Innovation. Mo and Iveta will talk about innovation. Implementation science. We need to do more. We will publish more implementation science paper in our journal. Recognizes that global health issues are also entwined in local settings. So go see your mayor. And also, of course, mainstreaming global health in all policy. Health for all, health in all policies. Antimicrobial resistance, it's not on DG Santé, on health people, it's on agriculture and fishing. And yes, they are better lobbyists than we are because they bring tractors to Brussels, and that's a good way to make a point. While we can brainstorm to know what are our tractors as public health, we have to find new options. New options is diplomacy, is public health diplomacy. But to do that, we need equity, and we know, and of course, Charles and Emma, our panelists, will focus on that too, that global health is affecting deprived, marginalized population more. But it's not only about access to service, it's about how we build the science. It's access to knowledge, it's access to knowledge creation, and how many of you are connecting with community, how many of you acknowledge them, and how many of you co-authors with people with lived experience. And you know what, it's not just about decolonizing public health, though it's really, really important to acknowledge that our science is framed by Western colonial frameworks, but also it makes better policies. We need power, we need competencies to change that. This is the Ilona Kickbush strategies that were released in 2015, the kind of competency we want to do, and with WHO and ASPHER, we're putting forces together to create better training, continuous education to empower global health diplomacy. But it's also about engagement. Engagement is going and getting in scientist rebellion. I don't know if many people are here. Sometimes it's a good way to fight eco-anxiety. Do you have eco-anxiety? Can I see your hand if you feel that? No, a little bit more. Good for you, those who don't have eco-anxiety. But it's a real problem also. It's institutional, and again, quoting Martin McKee, but Trump is leaving many seats. We can't take the seats, so we need to use this momentum. And last thing, global health is cultural. Global health is political. It requires fierce diplomacy and resilience because it's hard. We are facing very fierce adversary, and we need to be fiercer because life depends on it. Science is our foundation. Culture and politics are our vehicle. So how can we, sorry, I lost my last, I have a quote, so that's why I need my paper. Okay, well, I'll quote it from heart. We need to see how we can make this musical happen. How do we connect to communities? How do we do better to make our case outside of this table? How can we help you? How can you engage more people in next European Public Health Week in your country? How can you bring finance, agriculture, fishing in next EPH conference in Helsinki? And I know we had to close the door. We'll have to make bigger rooms because we need the other people. We need to stop being an echo chamber. We need to share the science, but we need to do more. So together, we want to help you find the solution, but also make them happen. And my last quote is Paulo Freire, the philosopher, educationer, amazing Brazilian person. As long as I fight, I'm moved by hope. And if I fight with hope, then I can wait. So we cannot wait to fight, and we cannot wait to hope. Thank you very much.
Charlotte, thank you very much for the great introduction into today's topic. Now I would like to invite our panelists to come to the stage, and in the meantime, I'm giving floor again to you and to Elena with the second Slido question. So panelists, please come to the floor. In the meantime, we are using the time so that we are very efficient and effective. We will introduce you one by one later, so thank you very much. Please take your seats. And Elena, you can start your question.
I think we didn't get a chance to look at the world cloud, but you got to see it in your, I think equity was high up there. There are different topics that are all being discussed in the INB. We're very happy this morning, the first session, to have almost 100 people for the pandemic treaty. Yes, thank you. So this is cross-cutting priorities. We hope that we can map this and move forward, along with the next two questions that follow, and the panelists' input. We would like to use this to inform the global health strategy for the section and, of course, the global health aspects in the EUPHA strategy. So if we can go in terms of Slido to the next question. Yes, so we are public health professionals, and this is EUPHA and ASPHER coming together, and competencies figure very high. We want to know, irrespective of whether you are a practitioner, whether you are in academia, or where you are, we would like to know what competency you think is the most important for global health right now. Things are more geopolitical than ever. So, Iveta, maybe we wait for a few minutes, 1 second. Yeah. Education, nutrition,
It's
generosity.
more for
Okay.
Henrique and ASPHER,
Yes.
but also for us, of course.
Yes, I think Henrique may have a lot to say about this. Diplomacy, of course, policy.
Yeah.
Yes,
great.
advocacy and communication, which are things that usually we're not trained for in medicine or in public health.
Great. Yeah, it looks very promising.
So please do use the Mentimeter and do use the Slido because, of course, including those of you that are streaming it, because we do want to hear more about your the things that we haven't thought about. Critical thinking is not something we have thought about, but I think in the last session somebody said critical appraisal skills, evidence, assessing evidence, and so on. So I think generosity is upvoted. Very nice.
Perfect. Elena, maybe we can present the results later at the end of the session. You will be monitoring all the answers.
Let's go
please continue to engage.
So next to your poll, you also have a Q&A. So please start sending this, and we'll be monitoring. Thanks, Iveta. Yep. Okay.
Shall we begin?
We can go,
yes.
Okay, so now it's time for listening to our panel of very, very important persons in this area. So it's my pleasure to call on Emma Rawson-Te Patu. She is the president of the World Federation of Public Health Associations. And director of ManuKahu Associates in New Zealand. Emma, you are so much involved with indigenous health advocacy. You have been so present in the global health scene from the other side of the world, exactly the other side of the world, in fact, regarding Portugal. So it would be very nice to hear from you how you see namely, beside the other things, the role of Europe in all this movement of global health.
I'm sorry, I'm going to have to ask you to repeat that. I didn't hear the last part of the question.
Sorry?
I don't think you can be heard.
I can't
Definitely
hear you
not
very
here.
well. If you could just repeat it one more time.
Oh, I was just saying that with your experience and being in a completely other side of the world regarding Portugal, it would be very, very nice for us to listen, besides the other things you're going to tell us, how you see the role of Europe in this movement of global health.
Sure.
Difficult question.
Yeah, thank you. And yes, thank you very much for the welcome. And I am the current president of the World Federation of Public Health Associations. The other important part that I need to mention around that is I'm the first Indigenous woman to hold this position. And I think that puts me in a very unique position in terms of how I observe public health globally, and then how I observe public health from a European perspective. And I think one of the most important things for me when I think about how we can be as effective as we possibly can be, no matter where we're from, is understanding our context and our history and the contribution of our context and our history to the health and well-being and equity of all people around the planet. And I think that from my observation, from being here just this week, but also from spending some time earlier in the month in Austria and in Geneva, it's the same kind of I think missing pieces in terms of that whole, what is the context? How do you understand your context as a public health community in Europe? And then what is your contribution to re-educating, re-understanding, relearning about the importance of your history and your context and how you can better contribute on the whole to the global public health situation.
Since there's more time.
Emma, I'm wondering, you did not have slides?
Oh,
Yeah.
you want that now?
Yeah.
Okay.
Sorry.
The agenda's slightly different. Okay.
Yes.
Good.
May I ask the technicians to put
Okay.
on the slides?
Well, I will
Thank
stand
you.
up then. Let's change tack. Sorry about that. Well, you've heard a little bit about what I have to say already, so I'll just try and reorient myself to what I was supposed to do. Some of you will be aware of this image, some of you may not. Does anyone know what this image is? Few people? Yep. So this is from around the 1950s in the United States, a television series that came from some other storytelling, I guess, around this guy called the Lone Ranger, and the Lone Ranger and his sidekick Tonto. I like this picture because it says a number of things. It is a picture of an Indigenous person who was the sidekick to a white male who was seen as the saviour, I guess, the lawmaker, the person to go to in times of trouble. They're sitting over a campfire and they're cooking something up. I think this is a really important image in terms of what I just described around understanding your context and understanding your history. Once upon a time in the United States, and probably still too much today, this was an image of something positive. This is not an image of something positive. This is an image of an oppressive relationship between one group of people that has a lot of power and another group of people that doesn't. When I think about the importance of what we need to understand and lean into in terms of global public health, it's really around leadership and understanding what leadership really looks like, what it needs to look like, and the challenge that we need to lean into around being really good leaders. And Charlotte alluded to some of this earlier. It's about the kindness that we exert. It's about understanding, again, as I said, our context and our history so that we can be the best public health practitioner, no matter what that looks like, because we know that that looks like a broad range of things. How can I be the best public health practitioner that I can possibly be to deliver the best service and the best engagement with the populations that need me the most? I was really interested in that slide from the Slido that says, when we were looking at the most important competencies in terms of public health, it said the most important one that it was showing at the time, 31 people said communication. It said 5 people thought trust was the most important. I mean, that's fascinating to me because without trust, you can't have relationship. Without relationship, you can't have engagement. Without engagement, you don't have uptake in all of the things that we profess to want people to do and be invested in for their own individual health, but also for their community and the planet. So up in front of you, you're just looking at the goals of the Federation, and I wanted to highlight these because there's some important parts in here, and I know I haven't got very long. The first goal for the Federation is advocating for peace. Okay, peace and safety are prerequisites for health. There are so many people around this planet that do not get to experience peace and safety every day of their lives. And again, Charlotte alluded to, this is about life and death. So when I stand in front of you, I stand in front of you as an Indigenous person, Indigenous woman, who every day when I stand up or when I get up out of bed, it's about life and death for my people and other people like mine around this planet, the 500 million of them that don't get acknowledged, that don't have their history acknowledged, don't have their context acknowledged, and cannot even stand on stages like I do and feel safe about being able to say the things that I'm just saying to you and going home and being safe. So very important that for us, for the Federation, for public health, that peace and safety are the most important things that we need to consider in all of our actions and our leadership. How much time have I got?
You are out of time.
I'm out of time. I'm out of time. Well, that's all right. You'll hear more from me later. But anyway, so that's really the bent of all the things that I had to say, and you'll hear some more about me later. But there we go. Health is a human right. Know your history, know your context.
Thanks a lot. I hope we will have
Time for
second round of questions. Thank you very much, Emma.
So now it's time to listen to Charles Agyemang. He's a professor of global migration, ethnicity, and health at the University of Amsterdam, and also professor at Johns Hopkins. I think you have your slides, so Charles, it would be great to listen to you.
Thank you very much. It's such a pleasure to be here. And when I was coming, I just said to myself, what is actually happening in our world today? You know, last week, it seems like when you talk about migration, it seems like it's becoming a word that no one wants to hear. And I said to myself, we live in a place where actually if you put migrants all together and you put them in one country, it will be the 5th largest country on earth. And how are you going to get rid of that? And how can we learn to make use of this group? And for that, that's basically I want to talk to you two about. And I will argue that actually with all the negative perspective that we are currently hearing about our world, about migrants, about minorities and that, it still offers wonderful opportunities, particularly in terms of global health. And I think this is what I actually want to focus on. Why is it important? Because I think that, you know, building collaboration today is one of the most, I would say, that important things in public health, particularly for the global south. How do you maintain this important collaboration that you do? And I think that when you talk in terms of migrants, particularly when you are looking at what I call the role of migrants, where you compare the migrant population to their home countries. And that gives you an excellent opportunity to be able to build actually collaborations across countries. And I will show you some of the experiences that you have. This is the work that we did, basically called the Rodam study. And with this study, what we actually wanted to do is to compare the migrant back to their home country. And in this situation, you focus on the Ghanaian migrants that have moved to London, that have moved to Amsterdam, those moved to Berlin, and those that actually live in the rural and urban Ghana. So you use this method actually to see how you can actually build collaborations across Europe and also across where these migrant populations are coming from. And I think this has been a wonderful experience. Of course, if I have to tell you about the scientific part, it would take me several months to do that. We published almost about 80 papers out of that. So it's a huge opportunity. But the point here is basically to see how we can actually use this to build collaborations and also to promote, to build capacity. And because of this, you actually use this, you've now set up a very nice collaboration between our university and University of Ghana, where you actually using this as a platform whereby our, at all levels, you have clinicians, you have students, and doing an exchange. And it's given an excellent opportunity to be able to exchange it because people go there, they learn from Africa, they come back, they use it, and vice versa.
Absolutely.
And also, more importantly, also when you talk in terms of capacity building, it has been a wonderful experience to see how we can actually use this program to actually train people both in Europe and also those living in many African countries and globally. So this migration provided an excellent opportunity for capacity building. And all those people that we see here, all of them from different parts of the world have actually managed to finish their thesis. Some of them have become professors as I speak. And so it's a wonderful experience to see. And so many of them are also now being trained for that. And also to do that now, we've actually translated this into a prospective cohort. So if in the coming years, you build a collaboration whereby you can continue to follow this migrant over time, and in the process, training people both in Europe and also in many African countries to ensure that actually we just need to collaborate. We cannot separate together. The world is becoming a complete one melting pot. So we need to find ways to ensure that you can use this advantage to promote diversity across that. And also, even more importantly, when you do this, it leads to a spin-off. And in this project now, because of Rodam, now you have a very nice EU project that we just started this year, where you actually focus on the young population, the adolescents. How can you improve non-communicable diseases or cardiometabolic diseases among this population? And this is being done in many of the countries. And another one is also here, where you are looking at how you can actually promote a healthy environment for children in many African countries and elsewhere. So I think that in order not to talk too much, what I would say is that migration, regardless of what you are saying about it, has a huge benefit, right? Just imagine Europe without migrants. What is going to happen to our hospitals? So migration, regardless of the current reality, you need to realize that it has a lot to offer, and you need to embrace it, and we need to ensure that those people that are in it now feel comfortable and they can all be able to contribute to society at large. Thank you very much.
Thank you so much, Charles. Thank you. Thanks a lot for presenting us your impressive work, very impressive. And I'm also glad that you are a long-term collaborator of EUPHA, the Vice President of the section on migrant health and Secretary of the EUPHA's Executive Council. So it's really nice that you are also very active in the EUPHA. Our next speaker is a dear guest as well, Professor Agnès Buzyn, Professor of Haematology from Paris-Sorbonne University and former Minister of Solidarity and Health in France. Agnès, with your experience in public health policy and leadership, especially during the very challenging COVID-19 times, what role do you believe innovation in policy and governance plays in addressing global health crisis more effectively, especially in the face of future pandemics? And as you know, I always want to hear your story about the public health community, how we abandoned you in very difficult times. So if you could touch upon that, please.
Thank you, Iveta. Yeah, it works. Okay, thank you for inviting me. And really, I would like to focus on crisis. I think we are facing a new world, a very dangerous new world. And I think the pandemic crisis is the first one, but will not be the last one for sure. I think we are facing a world of multi-crisis because of the way we live, because of the way we eat, because of the way we move and travel and use the nature, the relationship between the climate change, of course, and disease, very many determinants. But because of wars, because of migration, because of so many things, we are going to face multi-crisis. And I will come back to the pandemic. It's very interesting. WHO is publishing the number of outbreaks between the year 2011 to 2017. And there were about 1,300 outbreaks in the world. That's a lot. This is almost 4 alerts per week. Hopefully, they are not all evaluating into a pandemic. We had only one, but it means that it's accelerating. And there is a sentence that the DG of WHO is always starting his speech with, and he always says, we were not prepared. The world was not prepared. I don't think it's true. And I think it's the issue, because we cannot get the right answer if we don't understand what went wrong. We were prepared, not everywhere, but at least in high-income countries, we had so many regulations around preparedness. We had, of course, the international health regulation. We had joint evaluation by WHO. We had ranking of our countries on preparedness by the Johns Hopkins Hospital. The US was the first best prepared country in the world by Johns Hopkins. France was, I think, the 3rd or 5th one. So we had so many exercises. We had stocks of masks and so on. Not enough, but okay. So the real question is why this went so wrong. And I have few answers, but I think this work has to be done. Has to be done by your community. Now that the crisis is far behind us, that we have no emotion. The first, I would say the first problem was transparency. When you look on the way we communicated, or Chinese authority communicated about the virus, they knew about the interhuman transmission quite early. But we got this information quite late, 1 month later, in the 23rd of January.
Yeah.
That's a huge information. And that means that you need transparency. And that's an issue for the treaty, because we are going to sign this treaty one day. But does it mean that it will work better? Does it mean that for non-democratic countries, they will communicate better with a treaty? I am not sure about that. The second issue was the bias of understanding what was going wrong. And bias were very strong in Europe because of what happened with H1N1 flu. We overreacted. We were very worried, and then the scientific community didn't want to make the same mistake again. And so the bias was to minimize. Don't worry, it's the flu. This is something I heard from my scientists in France. You are overreacting. That was not true in Asia, because they had the experience of the SARS and the MERS, and they did not have this minimizing bias. I think there is of course, many other reasons why we didn't, it didn't went right. But I think the main one is a fundamental misunderstanding of what is a crisis. A crisis happens when your preparedness is over, how do you say, I'm looking for the word, is overtaken by the event. It means that what you have prepared for years, spending a lot of money, millions, is not aligned with the event because of the magnitude, because of the characteristic of the virus, and so on. So you have to understand that what you have prepared for is not adapted. So you have to be, you have to adapt all the time. Procedures are not helping for a crisis, because procedures are done for other scenarios. And I like what the army is saying. They are always saying, the first victim of the war is the plan. It means that the plan is not adapted. And so this is really what I want to share with you. I think we have a misunderstanding because we said we were not prepared. No, we will never be prepared to the next crisis. We will be prepared to a coronavirus, to a flu, but if there is a prion in water, are we prepared? I'm sure we are not. I'm sure we're not. And the other thing we really have to work on, and this is something that you are good at, is the role of civil society. It's literacy. The countries who overcome well crises are the countries where the citizens are active stakeholders. They are not waiting everything from the state, because when a crisis arrives, the state is never prepared enough, of course. And so citizens have to understand that they will act because they need to act, because we are facing a world more and more dangerous, the world of multi-crisis. So thank you very much.
Thank you very much, Agnès. Thank you. Thank you for this powerful message, and I hope that we as a public health community and researchers will learn from this, and for the future we can be more effective. Our last dear guest today, last but not least, is Moderators Dr. Moderators, who is a lead public health innovation at the WHO Europe. And he is driving sustainable impact and equitable health outcomes. As a former regional advisor for science and innovation at Africa, he developed the first strategy for scaling up health innovation that was unanimously approved by 47 member states. Mo, given your extensive work with WHO Africa on health innovation, what do you see as the biggest learning opportunities that we can be adopted in the European region?
Thank you so much, Iveta, and it's a pleasure really to be part of this esteemed panel. Yes, I liked when you introduced this session and focusing on reverse innovation. Probably this is an opportunity to share with the audience how organizations can cross-pollinate ideas, and also ideas coming from, you know, the low and medium income countries to the more developed countries. So just to your question, one of the things that I learned during my time as the innovation lead in WHO Africa was you need to obey your boss. And if it's an existential threat, you definitely need to shape up. So why am I telling you this story? The amazing innovation work that took place in WHO Africa region did not just emerge from Norway. It was a demand, or it was demanded by the member states. They demanded more from the regional office. And thanks to the visionary leadership of Dr. Moeti, who spearheaded WHO reform, which is called Transformation Agenda. And at the core of that transformation agenda, as you can imagine, innovation was one of the pillars. And we needed to do something. So to kick off this innovation initiative then, we said, what are we going to do? We need to leverage our own assets on the continent. We needed to understand the landscape of innovation on the continent. So we put up a call, a challenge, you know, requesting for solutions across different domains, technological, product, service, processes. Behind that strategy was to try and understand what exactly are we seated on the continent. So that was the first thing. Lo and behold, we received more than we bargained. We received 3,500 submissions from innovators across the continent. We've just opened a Pandora box. Then we actually said, no, we need to be advised. We reached out to experts for consultation. Now that WHO's role has been underpinned as a convener of innovators in public health, but how can we optimize our role in this space? So when we carried out this consultation with various stakeholders in the innovation ecosystem across the continent as well as outside the continent, we began to institutionalize that work as part of WHO's work, to be part of the DNA. It was incredible. Now we have heeded the call. So the first learning is you need to obey your boss. You need to obey the boss. But that boss, we said, we need to develop a regional strategy like what Iveta has said. Because the innovations that we're going to harvest, they should find their way at country level. So we need to develop a regional strategy for scaling up health innovation that member states should be accountable for. Lesson number 2, make your boss accountable as well. So when we did that, you know, when COVID-19 struck, we had laid a foundation for innovation. Now, us being the convener, we were able to pull these innovators across the continent to co-create solutions that will contribute to COVID-19 response. I remember all the pillars of COVID-19 response, from IPC, surveillance, you know, case management, contact tracing, and all that. We actually said we do have the assets, we do have people that can co-create. Let's tell us our challenges, and they can actually come up with solutions. And COVID-19 actually gave impetus to strengthen that innovation program at WHO. And that's why we created an innovation platform, which received actually, which was patronized by over 10 million people across the continent and beyond. It's a platform where innovators, governments, funders could come and co-create solutions. And an extension of that, we said, no, not again. WHO should be ahead of the curve. We started now scanning the horizon for emerging technologies and work closely with program areas so that they can initiate strategic dialogue at country level. And we engaged private sector and also helping countries to strengthen their local innovation ecosystem. In Botswana, we helped them set up what is called an innovation management system. In Niger, we presented an investment case. In Uganda, we managed to set up what is called an health innovation cluster that was actually nested within the Ministry of Health. In Ghana, we actually managed to help them set up what is called National Vaccine Institute. These were really great examples. Just to say, these are just publications as part of the iceberg to say we managed to really contribute impact in Africa. So now the learnings that can be translated in the European region. When I assumed my role as the public health innovation lead, I scanned the horizon and I realized in as much as Europe has peculiar challenges, but we realized that it's entrenched in payment crisis, like what Charlotte said. You know, there's a widening gap between industry-led innovation as well as public health system. And there is an untapped potential for that we can leverage through innovation hubs and innovation parks. So with that, if you were following the proceedings for the regional committee 2 weeks ago, you realize that member states endorsed or supported the development of a regional strategy for harnessing innovation for public health. This was a key sort of learning from the experience of Afro. And now we are setting up a technical advisory group that is going to work with us, advising us on innovation initiatives that will support building of an innovation ecosystem in the European region. We are also targeting innovation hubs because we know the knowledge institutions are there, but they are working probably in silos. We are pulling them together so that they can co-create solutions that affect the region. And lastly, we know countries are doing well, and there are also pockets of excellence. We're going to hand down for some of the best practices that we can actually initiate knowledge sharing across the whole region. And this is what I can say. Thank you so much.
Perfect.
And my apologies for taking time.
Thank you very much, Noel. Thank you very much for helping us to innovate the Europe, so to speak. And now I know there were a lot of questions from the audience, so I'm giving the floor back to Elena to take perhaps some of the questions. We still have some time.
So first of all, thank you all for sending many, many questions. Also, I know that we live in a very strenuous time. It's a time of conflict. Agnès mentioned how many pandemic or crises we had or infectious disease outbreaks. We have also more than 150 wars currently ongoing. So I know many of you sending questions about Gaza. We acknowledge this, and I think Charlotte started with this. The statement for Gaza is there. It's been endorsed by the governing board yesterday. And every association was there, including Israel's representation. So please take a look at it, and we're more than happy to engage on that. Going back to the question, this is just to say we definitely acknowledge the question, and we definitely understand this is a very important topic. Back to the plenary speakers, and this is to all of you for very brief statements. I will go through the questions. Please make a statement that you think is more relevant to your own expertise and background. So we had very diverse presentations, and we have rather diverse questions, somewhat focused in the European region. So, no, I don't want to go to the question in the slider yet. We are in the questions, not second question. So the questions that we got, now we cannot see the questions that we got, but it doesn't matter. So the questions that we got, I have here. So it's what is an example of policy or program or technology from a developing country that you think Europe would benefit to implement? Many things were mentioned by the last speaker, but I think we can be more concrete or more concise. Yes, thank you for sharing. What role does the European public health community have in bolstering the development of public health capacities in LMICs without a colonial mindset or approach? This links also to competencies, but of course to partnerships and collaboration. And if you see, we try to have not only EUPHA people, but representation broadly from across settings. According to a Lancet analysis, the only two correlates to country effectively responding to COVID-19 is trust in others and trust in government, which is why New Zealand did great and the US did not. How do we build trust in public health everywhere? And of course, this links very much to misinformation, disinformation, and infodemic management. And last but certainly not least, we have had a couple of questions on the INB and so on. So of course, there are questions about lasting impacts of the pandemic policies transmission, travel bans, and what is needed to have policymakers organized and efficient and equitable. And this is very important because equitable access is actually debated in the Intergovernmental Panel for the Pandemic Treaty that Charlotte also mentioned, for global distribution of scarce health resources, and of course for access to innovation, timely access to innovation, because we all know what happened with vaccines and also even recently with mpox. So without further ado, I think we start with Charlotte and then we take it from there. Thank you.
Yes, very short answers, okay? Just 2 or 3 sentences max.
So, I don't have a magic wand, obviously, but my big secret, not so secret plan is to empower all of you so you run for office, like as member of parliament like Sarah, as member of European Parliament, as mayors and everything. So then we have trained people, and then you can do things and you have equity in your background. So I think if we want to change policymaker, one good solution is to become a policymaker. And we're happy to help you.
Who is next? Maybe Mo, you can just continue with some question which you like from the pool of the questions or comments on some other things. Okay, maybe Agnès, I see that you are ready.
I raise my hand
Yes.
because there are so many questions, so interesting. I would answer 2 of them. It's not the answer, but maybe to give insight. The first one is the global health architecture and the post-colonial approach. I completely agree. I was amazed. I have been working WHO for 2 years during the pandemic in 2021 and 2022. I was the Assistant Director General in charge of diplomacy at WHO. And I realized how many structures, institutions we have in global health. I will quote some of them for CEPI, Gavi, Global Fund, UNITAID, and so many. And there is a lot of money, a lot, billions. And we don't understand who is doing what, where goes the money, is it efficient? And I think that your public health community could work on this global health architecture to change the mindset, because many of those institutions work the way we work 100 years ago. So I'm sure that my colleagues can further comment.
Yeah, so Charles, you would like to continue?
Yeah, I think
Please
for me,
take your microphone.
Oh, yeah, sorry.
Oh, you
I'm
have
sorry,
a
I'll
headset.
take the microphone.
Can you hear me now? Yeah, okay.
Okay.
I think for me, what is really important, especially from what I see, is collaboration is so important. I mean, working across sectors and others, we just need to find a way of basically connecting with each other, because you can learn so much from each group. And relating to migrant health as well, I think I just want to make this point, that it's so important that, you know, everywhere you go now, you're talking about diversity, right? Diversity is great, but I think that it's about time that we start actually walking the talk, right? And that means that we need to ensure that within all society, regardless of your background, everyone have equal access to healthcare. And I think it's very important when you talk to access to healthcare. Often people used to think that, oh, just right and others. Let's put the right aside. Just imagine if you have someone else who have hypertension and you don't treat it. They will come to the hospital with stroke. There you treat it. And the society will certainly pay a heavy price for it. So it's very important that we take measures to ensure that we actually protect people, because in the end, it will be a benefit for all. And I think I also want to mention that because especially you're talking about migrant health. Next year, the same place, actually in Lisbon, you're going to have a very wonderful meeting on migrant health, basically Global Society of Migration, Ethnicity and Health, having a conference here, basically addressing these specific issues. And there you go in details. So those people that are interested in that, this is your opportunity for you to be able to engage with us. And also the EUPHA section part of the migrant health is very actively involved.
Yeah.
And then you can really try and ensure that you can actually discuss this topic and ensure that, in terms of health, everyone else have access and everyone else is also, more importantly, you can also help our clinicians and others to be able to be trained so that they can provide the services that they want to provide to people so that everyone feel happy. Thank you.
Great. Thank you. Emma, yes. Final remarks, and then Mo.
Yeah.
Thank you. Can you hear me out? Do I need to use this one? Yeah.
Maybe the microphone is more safe.
Kia ora. I'd just like to, sort of go further from Charles's contribution around collaboration. Collaboration is significantly important. Relationship is significantly important. When we talk about both of those things, we have to talk about our understanding of time. We put so much value on getting things done very fast, and we're pushed into doing things very fast because the world is moving very fast. But we don't put enough value on spending time on relationship and decent, long-term sustainable collaboration. And so in the world that I come from, we have a term, it's called WA, and WA is our version of time, but time is about when you have a task, the task tells you when it's finished.
Yeah.
And that means it requires of you a different sense and a different way of being to allow for that to happen. And we don't often in the world that we're in allow for things to show us what we're supposed to do with them. And so when I say this, it's really important to understand that different knowledge systems, different science systems are really important. Which knowledges are valued in the work that we do? And too often there's only one kind of knowledge that's valued. So when we're talking about collaboration, relationship, knowledge, science, what are we actually talking about and whose version of that is included in the conversation?
Yes. Thank you.
Yes, I saw a comment about the opportunity for Afro and Euro collaborating together. Yes, I think this is a pertinent question, and I think it's high time, especially the wealthy countries, get away from this belief that you can develop solutions that will fit the context of Africa. I think COVID-19 has shown that, and now you know that there is this local manufacturing agenda that is really high as a political agenda in both in Africa and also in the European countries. So I feel that that partnership, equal partnership, of course, leveraging our comparative advantage, this is what we need to do.
Yes.
A case in point, I was part of a team that set up what is called an mRNA transfer hub, a technology transfer hub in South Africa. And members that are part of that hub are also from this part of the world. And this is what we call a partnership, and global partnership for global health. And another example that I have, there is an innovation which is called Friendship Bench. Those people that are in mental health space, they probably know it. It was developed in Zimbabwe. It uses local resources. It's an asset-based approach of training these grandmothers on cognitive therapy and provide, counseling to youngsters and also people that are suffering from mental health in communities. And that Friendship Bench model, it's been adopted in the UK. I see presidents actually advocating for that. And this is what we call reverse innovation, as Iveta was saying. There are so many examples that can benefit this part of the world and coming from
Amazing.
the other part of the world.
Thank you.
Thank you so much.
Thank you so much for all the inputs, for sharing your experience, your thoughts, your ideas. Elena, Henrique, do you have enough I've learned a lot today, and I would like to just ask you for the final reflections.
So I
do we
think
have
there's-
enough for the global health section?
So
in
there's the
EUPHA?
last poll, and you see similar things. I think most of you already know, and I think we will have it on the close, that we have a new strategy for EUPHA. You heard a little bit about it, and we have a new strategy for the global health section. I'm very happy that some of the panelists have already agreed to be in the advisory board. Please reach out. The document for the global health strategy for the section is updated and it's uploaded, but we want comments from everyone because we all come from different perspectives. You just heard a very good example. I come from a background of clinical trials, so mRNA was my past, let us say. So please, and reverse innovation is also social or cognitive behavioral therapy. So please send us your ideas, be more actively involved. Also to say tomorrow is a join the network session, so we welcome everybody. And I'm very happy to say we can continue this discussion because this was the start of the discussion, as well as this morning's panel for positioning and having a pan-society approach with the Federation, hopefully with ASPHER, hopefully with EUPHA, on critical topics that have to do with global health. I think we could be more vocal in Europe about global health things, particularly as the European Union has released a global health strategy, which is very ambitious, not necessarily very concrete in actioning, so we want to contribute there. That's it from me.
Thank you.
Thank you.
Thank you, Emma. Okay, so it was great. I would pick up the words equity, communication, advocacy, and allow me to say that from all that was said here today, if we think about global health, we should think about the global healthcare force. And we need to make it also fair the way people that cares is distributed, and we are not taking the best of the workforce from low and middle income countries to high income countries, because if we continue to do it, there will not be a real global fair health.
Amazing. Thank you so much. Thank you, the panelists, the speakers, Elena, Henrique, for collaboration, and thank you all for joining this session, and enjoy the evening, the reception.
Oh my goodness.